was talking about initially, instead of just kind of globally suppressing the immunity, which is kind of more the role of prednisone. Prednisone, I think, has been around since my grandfather's time. I'm a third-generation physician, so I kind of like the history of medicine a little bit in terms of hearing how things develop. And Imurans and cyclosporin have been around at least 30 or 40 years. Cellcept's a fairly new drug. Has been on the market, I think, only about maybe 10 years or so. And all three of them tend to work very well, but they're very slow acting. And so usually what happens is that we start people on prednisone with an eye towards starting one of these other agents, generally, hoping to get people all the way off of the prednisone because of all the side effect issues I mentioned to you guys earlier. So, ideally, if we can get somebody over to Imuran, it's typically the drug companies prefer because it's the cheapest of the group. If not, Cellcept, which is the most expensive of the group, they all tend to be worthwhile. Now, these drugs are not without side effects either, and in fact, if you read the package inserts, they talk about B-cell lymphomas and other things, again, suppressing things so much that you can let the body get a little out of whack. Knock on wood, I haven't seen those things. I have had to adjust medication dosages with Imuran and with Cellcept periodically, but practically speaking, they've been good drugs, and I have been able to keep people off of prednisone by keeping using those drugs as well anyway too, so I'm pretty satisfied with those overall. Other drugs and strategies that we might use, I see we've got our plasmapheresis bags over here anyway too. Dr. Frieden, who's a hospital-based neurologist who, thank God, showed up a couple of years ago, so I don't have to be here all night on top of being in the office all day, is a fan of plasmapheresis, and if you come into the hospital, he may work with you guys on, if you come in acutely, we don't tend to be here except a couple of days every 3 weeks anymore, and so there may be an opportunity to either do plasmapheresis or another technique that I'll mention in a minute. Plasmapheresis is similar to dialysis. They put a big catheter in, usually right here underneath your collarbone, and then they basically pull off 3 or 4 liters of fluid, it depends on your body size. You're a lot smaller than I am. They pull a lot less off of you than they would off of me. And we used to usually shoot for about half of the circulating volume of the body, and then every other day for 10 days we basically strain that through the filters and try and pull out all these little protein complexes that are the immune complexes that again are attacking that membrane we talked about at the beginning anyway. It's very effective. And back, again, when I trained, a lot of these other drugs and strategies weren't available, including the IVIGG I'll talk to you about in a minute. And so we used that all the time. And we had Harvard Hospital in Detroit at any given point in time. We probably had 1 and frequently 2 people that were undergoing plasmapheresis as one of the main teaching hospitals in the greater Detroit area anyway, too. It's a hard thing. Any of you guys who have friends or family who have been on dialysis, you know how wiped out they feel. This does the same thing. It absolutely throws people for a loop, which is part of why I try not to do it, unless we don't have another choice. It really is draining on people, and I always feel like I need to have an internist, because as neurologists we aren't trained in internal medicine. We go right into neurology residency out of into our internship now. I don't even do rotating internships like I did back when I had to deliver babies and do emergency room call and those sorts of things. So I like to have an internist or a nephrologist on board to kind of make sure all of the labs are matching up and that they fix them as soon as possible if anything's getting out of whack, because it's pretty easy to start throwing calcium, magnesium, potassium, sodiums, and those sorts of things out of line a little bit when they're running that stuff through you. And but again, people do real well, and typically if patients aren't responding to anything else, plasmapheresing them, every few months, often is a strategy that can be helpful in terms of keeping people out of trouble. If they do it, if I haven't seen anybody that's been in a position to get it done every few months like we used to do back in the day, just again like dialysis patients, if it was somebody getting those things done, they put a shunt in them usually, so that you didn't have to keep having big bore IV put in up high and stuff anyway too. More often now what we do is we use use IVIGG. Intravenous immunoglobulin is spun down from the serum of thousands, if not tens of thousands, of blood donors, and is ridiculously expensive dose by dose. I think each dose runs around $18,000. So we really, and typically we might be giving people 3 or 4 or 5 doses. Usually it's in critical situations, and without me violating anybody's confidence, you guys can talk all you want about it, but and if you say you want me to talk about it, I will. But I mean, practically speaking, it's a very potent drug in terms of helping with those symptoms in a fairly short period of time. I like it because, if we've got somebody who's in crisis, we can give it to them and they'll get out of crisis usually within a matter of a few days. And then that gives me time to kind of work with prednisone or, one of the other agents, the Imuran or something along those lines to try and get in place, because it may give you, some protection for several months again, and that's about the length of time it takes for Imuran or cyclosporin or Cellcept to start working anyway too. So I think that those are all pretty good choices along those lines anyway as well. It is IV. It can cause kidney damage. It can cause other types of problems, just like with any blood product. At least the Foundation's website, when I was reading it, said no HIV had been transmitted to date, but hepatitis C and some of these other things have occasionally slipped through. So there's all those blood product issues. Interestingly, I do have one patient who's getting that, who isn't, not for myasthenia, but he's a Jehovah's Witness, and he's got another type of nerve problem, and we actually went through the church board with the Jehovah's, and turns out it's okay for him to get it because it's serum, it's not cells. And so, if you know somebody who's in that boat, that's just kind of good to have in my back pocket now that, apparently we can get through this through some medical appeal board or something anyway too. So that's kind of nice to have anyway as well. So I think those are probably the mainstays of treatments in terms of what's out there right now. I think that it's really critical to have a good quality relationship with your neurologist, and it's hard to find neurologists. We're super busy. I appreciate everybody's patience waiting us out in the office trying to work through the things we've worked through and stuff too. But the notion of individualizing treatment is very, very important in myasthenia, because it's just not predictable enough to say take an aspirin and call me in the morning. It just doesn't work that way anyway too. So I think those are kind of the broad strokes of what I wanted to share with you guys tonight. I hope it's what you were looking for anyway, kind of short and sweet. I'm happy to answer questions about the treatments or anything else that you guys might want to chew on for a few minutes anyway too. Artists.
Remember when I had my heart surgery and Dr. Bagley took out my thymus, and then he asked me when I came in, well, my myasthenia was all cured now because he took that out. I said, don't work that way.
Yeah. Well, surgeons usually think they can cure things,
Yeah.
That's why they go into surgery, and like I said, I mean, I've seen, over the years, I've seen a couple of patients who've had virtually a cure from that sort of thing. They tend to be younger patients, and they tend to be patients